When my children were first diagnosed with autism, my first response was denial. Others would tell me, hey, they'll grow out of it, and I kind of went along with that. But with the love, care, support, and patience of early childhood educators, social workers, the pediatrician, and even other parents of children with disabilities, I got the courage to be more proactive. My next response was frustration. I was frustrated that I didn't have the tools to help my children. I couldn't help them through things like learning to speak or sensory processing issues or even tantrums. And this frustration grew into fear and anger. Fear that my children wouldn't be accepted by their peers or even given the opportunity to interact much with them. I was also afraid that my oldest son would be bullied due to sometimes drawing negative attention to himself due to ADHD. And at the same time, I was angry. Angry at the medical system and the school system not sharing pertinent information with each other that could help my children and other children with mental health conditions. And while I still sometimes feel these emotions, what I feel the most is acceptance. I accept my children's condition and the imperfect systems of care to support them through their youth and throughout their lifespan. And so now I channel the frustration, the fear, the anger into being a compassionate, fearless, and emotionally intelligent advocate for my children. If I were to do it all over again, I would skip the denial and I'd get right to leaning on other parents, and not just of children with disabilities, but all parents, educators, and mental health professionals.
The homeschool connection is a critical key in determining what's the next step for the student. It really helps educators to be able to diagnose the proper care for students in our class. Currently in my class, I have a student who talks too much during my lessons, asks to use the restroom several times throughout the class period, and when given independent work, they struggle with staying on focus and on task. After further observation of the student's behaviors, I noticed that these things were outside of the student's control. So I contacted the student's family and connected them with the healthcare professionals at my school. Together, the family and the healthcare professionals were able to get the student the necessary care that they needed, and the student was diagnosed with ADHD.
Children today have a lot more to deal with than children of generations past. Our children are vulnerable when it comes to social, emotional, and mental health issues. If the signs and symptoms are left untreated, children cannot develop the necessary skills and tools they need to develop and succeed in school and in life. That's where parents, teachers, and health professionals come into play. We all have a crucial role in ensuring the healthy development of our young people. We must educate ourselves on the signs and symptoms of mental health issues. Studies show that less than 20% of young people receive the help they need. Prevention is key. Identifying the signs and symptoms of behavioral health issues can save a life. Together, we have the power to make a difference. So let's work to ensure that our young people are happy, healthy, hopeful, inside and out.